Welcome to Navigating Life with Vision Loss, an AfterSight original podcast. In each episode, we share stories, insights, and practical advice to help you navigate the journey of living with low vision or blindness. Together, we'll embrace each step with courage, grace, and hope.
Hello, this is Kim Wardlow, and I'm your host for Navigating Life with Vision Loss. We're continuing on in our safety series. We're getting towards the end here, but we're still looking at different topics related to our safety. And today we're going to be looking at staying safe and confident in healthcare settings if you're a person who is blind or has low vision. And I'm excited for our guest today. Michael Hingson is our guest. He is currently the Chief Vision Officer at AccessiBe. He is the National Ambassador for the Braille Literacy Campaign of the National Federation of the Blind. And he's the author of several books, one of which you may be familiar with is Thunderdog, The True Story of a Blind Man, His Guide Dog, and The Triumph of Trust at Ground Zero, which was a New York Times bestseller. So you may be familiar with that. And back in 9/11, when Michael and his guide dog Roselle actually helped to guide folks out of one of the World Trade Center buildings. So his name might be familiar to you. But today he's here to talk to us about healthcare situations. So Michael, welcome.
Thank you. It's good to be here.
Is there anything else you want to tell folks about yourself?
Well, the other thing that I do a lot because of September 11th is I am a keynote speaker and I travel the world literally when invited and hired to come and talk about trust and teamwork and leadership. I get to talk about inclusion and diversity and other such things, and I teach people about blindness. And we talk a lot about emergency preparedness and so on. So it's one of the main ways that I get to do things. And as my wife and I decided soon after September 11th, talking about and literally selling life and philosophy is a whole lot more fun than what I was doing, which was managing a computer hardware sales team and selling computer hardware. So it's a lot more satisfying to do this. And so I've been doing it now for about 24 years.
Oh, wow. Well, that's great. Well, thank you for taking time to join us and speak with us today. As I said at the top of the program, we're going to be talking about safety in healthcare situations and understanding the challenges in those medical environments. From your perspective, what are the biggest barriers for patients who are blind or have vision loss in healthcare situations?
Most people don't know a lot about blindness or blind people. They don't know how to work with us. And let me give you an example. I had a crisis that started last December 23rd. And what essentially happened was it was discovered that I had a bad heart valve and it needed to be replaced. And so that actually took place. It was a fairly simple operation, relatively speaking. Today, it only took about an hour. And that took place in March of 2025. So it happened on December 23rd, 2024 that we discovered it. But in March of 2025, the operation took place. And the next morning, one of the people who I worked with but later in the operation process, one of the night nurses and I took a couple walks around the hospital, that floor, just to make sure that I was doing okay. But then a physical therapist came in and she said, "I want to walk with you to see how well you're walking." And I said, "Well, I did that already." "Well, I need to do it." I said, "Fine." She said, I want you to hold on to my shoulder." I said, "No, that is not the way it works. I'll hold your elbow." She absolutely refused to let me walk appropriately in the typical sighted guide way, and she walked out. That's not the way it ought to be. And I find that a lot of medical people tend not to know a lot about blindness and blind people, and they tend to view us in very negative and less than competent ways. I know many people who would want to take their guide dog with them to a physical examination or something that's not in an
Sure.
operating room, and people get refused, which is inappropriate. They get refused to allow their guide dog to come with them. The fact of the matter is that medical science needs to recognize that one size doesn't fit all. And in reality, it is okay for me in most cases to take my guide dog somewhere unless it's truly a sterile situation, like in an operating
Right.
room. And so that's one thing we have to deal with. But the other more important issue is a lot of medical people tend to have very negative opinions, very low opinions of blindness and blind people. And they think they know a whole lot more about being blind than we do. And the reality is they know significantly less than we do about what it means to be blind. And so I hope that some people will listen to this and realize that maybe there are things that they need to learn themselves. Nurses, doctors, others need to learn about blindness and blind people. And we're not as incompetent and as incapable as they believe we are.
Well, and now I'm curious, how did you handle that situation? Obviously, that person just that walked out, and that's not good. But how did you handle that? How did that play out?
Well,
Obviously, you're here today, so you survived everything.
Well, the reality is I'd already walked around the floor, which is what she
Right.
wanted to do anyway.
Right.
But after she left, I made sure that I told other people what she did. And I said, look, the reality is she knew nothing about how to walk sighted guide with a blind person. And I wasn't going to put myself in danger by walking the way she wanted to, because that doesn't work well. And there are reasons why holding on to a person's elbow is the way to go when you're walking sighted guide. And one of the people I told was the night nurse who had walked with me that morning, and he agreed. He said, yeah, this worked out really well. You and I we actually walked 3 times around the whole floor. So there was no question about me being okay. And this physical therapist could have gotten the information if she had just cooperated, but she thought she knew more about what it was like to be a blind person than I did. So I made sure that people at the hospital knew about it. Now, whether they did anything about it, I don't know. But nevertheless, I did make sure that they were aware that she did not treat me as she should have.
Yes, and it's important. That just highlights that it's really important for folks to kind of stick to what they know. As you said, you have the lived experience. You're the one who knows, not another person who has not lived as a blind person or a person with vision loss.
But the problem is that people in society generally think they know a whole lot more about blindness than blind people. And the big problem is they've never tried it. But the fact of the matter is that blindness isn't what people think it is. Blindness isn't the problem. It is traditionally societal attitudes about blindness that tend to be the problem. And so I do try to, whenever I have the opportunity, help educate people about blindness. I was at a store once and a young man came up to me and he said, I'm really sorry. And I said, why? I didn't know this kid at all. He was 13. And when I asked him why, he said, well, because you can't see. And I said, well, I'm really kind of sorry that you can, because you miss a lot of things that you otherwise ought to know about. His mother came along and grabbed him and took him away because she didn't want him talking to this blind person. But the fact of the matter is he apologized because I couldn't see and he could, which really meant that he had been taught that he was better than I was. And that's just not the way it is. So we do have to work on that. And it is something that society needs to work on. And medical science, medical professionals need to understand that their knowledge of blindness is very low. I went to an ophthalmologist once because I had a severe case of conjunctivitis. And the doctor, first of all, wouldn't talk to me. He would talk to my wife, who was in a wheelchair her whole life, but he wouldn't talk to me. And I finally said, let me point out to you that I'm going to be the one to pay your bills. So you really need to talk to me. And so finally he said, well, all I have to say to you is your eyes are mad at you. That doesn't tell me anything. I said, sir,
No.
I have a master's degree in physics from the University of California at Irvine, which was fairly close to where we were. I said, I know even something about medical science, and I know about blindness. If you're going to talk to me in an intelligent manner. He wouldn't do it. He just couldn't.
That's so discouraging.
Well, it's you can't get discouraged by it, because I've seen some doctors who do it really well. When we were going through the operation, the TAVR's operation dealing with the heart valve, I had conversation with doctors, and they asked a few questions about being blind and how I was going to move over to the operating table and other things like that. And they were fine. They were great. And most of the time, if people ask and are curious, we can get through it without any difficulty.
Well, and that's important because it can be a matter of your safety. As you said, you were asking her to guide you in a particular manner because that's the safest, that's how it's done. That's the safest way to do that. So it's important that people have the confidence to speak up, but sometimes individuals are afraid of when they self-advocate that they're going to be seen as difficult. Where is that balance? Because I feel like just from what you've said so far, it's so important. Even if you feel like you shouldn't have to necessarily educate or people have all these misconceptions that you're having to battle against, but you are needing to do that and needing to educate and needing to inform people. What is that balance? Because I feel like you did that in a way that was very, very civil, not yelling at somebody or anything like that. And yet you very strongly got your point across.
Well, I don't know whether it ever got across to her unless somebody else went back and lectured her later. But the reality is, if people view me as difficult, so be it. It doesn't matter. I'm the one who knows about being blind, and I'm the one who knows what I need. If they have some reason to do something in a different way, then they need to explain it, and then we'll discuss it. But the fact of the matter is, I know about me. I know about being blind. I have been a blind person for 75 years, so I think I have a little bit of knowledge about this. And so if I need to take a stand, I'm going to take a stand. And if she refuses to deal with it, then I'll ask to speak to her supervisor or someone else. But we do have to advocate for ourselves. We should all learn how to do that, because other people aren't going to do it nearly as well as we can if we learn the skills of advocating, if we learn the skills of speaking up for ourselves. Again, and you're right, it has to be done in a civil way. It has to be done in a way where you work to get your point across, but you're not a jerk about it. If people want to view that as being difficult, then so be it. Let them do that. It isn't going to change how I interact until somebody comes up with a better way to do it, and I don't think they're going to.
If a person is going to a new provider and it's a new relationship with this provider, do you have tips on how you explain your blindness or talking about your blindness or even other health information? Because going into a new situation, you're having to fill out, actually, even with doctors you've been with a long time, it seems like you're constantly having to fill out the forms every time you go in, and things aren't always accessible. I'm just dealing with all that, but particularly if it's a new provider who doesn't know you yet.
Well, I will take the approach of saying to a new provider or new people in a provider's office, let me tell you how this best works, and then let's go forward. And I will talk about filling out and completing forms. If they're on paper, I'm not going to complete them. If I'm with someone, they can complete them, or I will ask the service provider to do it. And if they say, well, we're too busy, I say, well, that's great, but then how are we going to get the forms filled out? You want them filled out? I'm perfectly glad to get them filled out, but I can tell you, you're not going to be able to read my handwriting because it doesn't work. So the bottom line is, I'm not going to read this form. I don't I don't have that in my toolbox, so we have to figure out another way to do it. And I'll always take the approach of let's figure out a way to make it happen. And mostly that works well. Mostly I don't find people who are as rigid as that ophthalmologist was or as that physical therapist was.
Mm-hmm.
Mostly I can find people to do things in a civil way. But when it doesn't happen, it's very unfortunate. But I'm not going to put my life in jeopardy to satisfy their lack of knowledge and lack of confidence in what I can do as a blind person. And I think that that isn't arrogance. I think it is something that comes from a lot of knowledge. And I think it is what we all have to deal with because we are our best advocates. We are our best um, people to accomplish tasks because we have the expertise of what we can and cannot, or what we know and don't know. We may not know everything that we don't know, but we certainly know what we know and we know
Mm-hmm.
how to live life. Now, I've had some doctors and other people in the medical world where when we start, um, they end up asking a lot of questions. And it's great. I'm always glad when people ask questions, and I will work to answer questions and educate all I can. I believe that, in fact, we are all part of a minority, and it isn't going to do us any good to be obnoxious. And I tend to like to be a teacher, so I will work to be a teacher. And I think that in reality, whether we like it or not, all of us are teachers, and we have to help educate the public and society.
And I just wanted to touch on confidentiality too, because that has come up. I've heard
Sure.
folks say, well, yes, the staff said they'd help me, but they're asking me all these, personal health questions in front of the whole room full of folks. And it's, not obviously not confidential. So being sure that you're asking for that confidentiality too.
Well, if there's a need to deal with things in a confidential way, um, then I will speak up and say, "Can we go somewhere because this is private?" Now, a lot of times, um, when I have to complete a form, even if there's somebody who goes to an appointment with me, we speak pretty quietly so we can do
Mm-hmm.
it. Um, so mostly I haven't found that to be a difficulty. But the reality is that if there's a true need for confidentiality in some manner, then I'll ask for a private space or uh, some help in getting to a place where we can complete the form without the whole world hearing it. Mostly,
Mm-hmm.
though, it also is a matter of speaking quietly, and that also works.
Mm-hmm.
Because in reality, if you're going to talk about it, sighted people are filling out these forms. Somebody could look over and see what they're completing too. So
True.
let's not make it more difficult than it needs to be. And the fact of the matter is that I think mostly we can make it work pretty well.
Well, we've talked a lot about being in medical environments, medical offices, hospitals, those types of things. But I want to just shift a bit to medical safety um, at home and having your records having accessible records or different safety tools that may have helped you the most coming from the tech industry. Are there technologies and apps that help you with your medical records, or have you found some of them that the doctors use to be not accessible?
I'm, in a sense, fortunate. I'm a patient through Kaiser Permanente, and a lot of their technology is accessible. I can go into the Kaiser app after blood tests or after lab tests when they're published and they're put in my record in the app, and I can go read them. Excuse me, I can go read them, and all of that works pretty well. Their app to order meds in my smartphone continues not to work well. They fix it and then it
Mm.
breaks again, and they haven't really learn to deal with that. I think the people at Kaiser who um, deal with these tend to, even there are a couple blind people who are part of it, but they don't keep enough on top of it. So it's a lot more difficult to order meds. So oftentimes I will do that by phone. But a
Hmm.
lot of what Kaiser does is accessible, probably more than with most places, at least that I found when I talk to other people and say, how do you learn about your lab tests and so on? Kaiser, they don't get the information like Kaiser provides it. Um, which is unfortunate because it should be pretty straightforward and easy to do today. And the reality is that they should be making that information available in an accessible form. Kaiser shouldn't have their drug pharmaceutical ordering process through the smartphone app not work all the time, although that
Hmm.
it continues to happen. So there are issues, but I do find that with Kaiser, much more is accessible than is not. And so I'm able to work on things pretty well. I can check in using my smartphone app, although I tend to not do that, not because of a lack of accessibility, but more a lack that I forget it, and so I go up to the counter and check in before before I
Right.
even remember that there is a way to do that on the phone. There are other things that Kaiser doesn't do as well as they should. So, for example, if I have to go in for a lab test, I'll be sitting, and I will go typically with someone because when it comes to be my turn to go in to get a blood draw, they don't typically announce that verbally. It just is all available on a screen. And that isn't something that Kaiser should allow to happen. So there are things that they've got to learn yet too. But
And
I
it
do
can
find that Kaiser works better than most places that I've heard about.
than others, yeah, because every system seems to be a little bit
Yeah.
different.
Yeah.
Yeah, for sure. Uh, in terms of labeling medications
Hmm,
and
okay.
things at home, I know
So
now you can get, things that will talk to you and
correct. And Kaiser has adopted that. So um, they use the Envision, and um, every bottle of medication that I get does come labeled. Once they messed up and they forgot to label items, but we got that fixed. But typically speaking, it is in my record that I'm not going to read medication labels. And so they have to put the special Envision label on. And Kaiser does that. I think that happened because they were going to be sued because they hadn't done it. I wasn't the one doing that, but now I can get access to knowing what all my medications are. I can pick up a bottle, I can scan it and know exactly what it is. And I think
and
there's also a smartphone app to do that, but I use their little device.
and that's in other pharmacies and places that people might be getting their prescriptions apart from like Kaiser or
Yes.
a hospital pharmacy.
Yeah, and so Envision and their technologies has gotten um pretty general coverage, and I know there are a number of pharmaceutical pharmacies and other places that use it as well. Um, Kaiser used to use a talking pill bottle where
Hmm.
somebody would record the information, and when you got your bottle, you could push a button to see what it is. That didn't work as well as the labels do today. But the labels have become fairly ubiquitous, and so you do find them in a lot of places, and it works well.
Are there any other tips you would have for folks or folks maybe who um, have not had been blind or have vision loss for their whole lives and it's something they're experiencing for the first time
Yeah.
later in life and just facing some of these issues for the first time?
Well, so again, one of the things I think is very important is that people need to learn that they're not less human simply because they've lost eyesight. And that is something that unfortunately all too often society teaches. They teach
Mhm.
being afraid of being blind. And people who are losing eyesight need to learn how to um, work and live and function in that environment. That's why we have organizations like the Colorado Center for the Blind, which really teach people who are losing eyesight or who have just recently lost eyesight, especially, and even some who never really learned the skills but who have been blind a while. The Colorado Center is great at teaching people about blindness. They're teaching that blindness isn't the problem, it's our perception that's the problem. So I'm a very strong advocate of people ought to um, explore going to places like the Colorado Center for the Blind to learn those skills. But for all of us, we have to be our own advocates. And it doesn't mean that we're a jerk just because we're advocating. What we need to do is to learn how to interact with people, which we all sort of know anyway, but we have to learn how to do that. We have to learn to stand up for our rights, and we have to learn to know what our rights are, which is, again, another reason to go to places like the Colorado Center or join like the National Federation of the Blind, which is the nation's largest civil rights organization of blind people in the country, where you will learn a lot about your rights and where you'll learn about all of this in a very substantive way from people who've been through it already. And so I urge people to take the position of wanting to learn about being blind and discovering that it isn't the problem that you think it is. Yeah, you'll do things in a different way than you did when you had your eyesight, but it doesn't mean that you can't do things. It just means that you may not do them exactly the same way. You may use a pill bottle with a special label on the bottom that you scan. You may use a white cane or a guide dog where you used to just walk yourself without having to do that. But it doesn't mean that you can and are any less efficient if you use a white cane or a guide dog. The fact is, blindness isn't the issue. Blindness isn't the problem. It's our own perceptions and the perceptions of others that is the biggest problem. You mentioned September 11th at the beginning of the conversation. And yes, I was in the World Trade Center and escaped from the 78th floor of Tower One because I learned what to do. I spent time learning what to do in the case of an emergency, although I never expected to be in one. But I knew as the leader of an office, I had to be prepared to help others get out. And that, of course, ended up happening on September 11th. And you mentioned Thunderdog, and we wrote that book. And last year, I published another book called Live Like a Guide Dog, True Stories from a Blind Man and His Dogs about being brave, overcoming adversity, and moving forward in faith. And that teaches people how they can learn to deal with fear, because they can learn that in reality, the world doesn't need to be something that they're afraid of, that they can use fear as a very powerful tool to help them focus. They don't have to be afraid of everything. And my belief is that life's an adventure, and we all need to learn how to live the adventure.
Mm-hmm. I think that's such a great outlook to have. As we encourage folks to advocate for themselves and help to change some of the misconceptions that people have about blindness. You mentioned there's just systemic issues within our medical system and within our culture. If you could change one thing about how healthcare handles accessibility, what would it be?
I would insist that as people are studying to be doctors and as people are studying to be nurses and so on, that there be a course of instruction that is mandatory teaching about blindness and other disabilities. One of the things that I tell people is in reality, every person on the planet has a disability. For most people, it's light dependence. You don't do well if you can see and suddenly the lights go out and it's nighttime or later in the evening and you don't have light. You scramble around to find a smartphone or a flashlight or a candle or whatever. The fact of the matter is we've spent 147 years since the light bulb was invented doing our best to cover up the disability of light dependence in people by making light on demand more available. It doesn't change the fact that the disability is still there. But unfortunately, people aren't taught to view it that way. So, okay, I appreciate that, but don't limit me just because you don't have the understanding about somebody who is different than you, that and the understanding that I have. And so I think it's very important that we truly provide a course of instruction to teach people who are going to be in these professions about blindness, and that blindness and other disabilities aren't really the problem. It's how we decide to view them that tends to be the real issue. You mentioned I'm the chief vision officer for AccessiBe, which is a company that helps make internet websites more inclusive. It's grown a lot in its understanding of disabilities over the years, but the reality is that it works in a variety of different ways now to make websites inclusive. Kaiser has done a pretty good job of making its website accessible. I'm not sure that that's true across the board. It should be. So again, if we provided a good course of instruction that taught people more about what it really is like and what it really means to be blind or have other kinds of disabilities, and they recognize things like discussing with us, not about us, behind our backs or right in front of us, and not including us in the discussion. If we're included, then we're in a much better position to be able to help.
In terms of our listeners, is there anything that you'd like to leave our listeners with, or a key, something key in terms of keeping themselves safe or feeling safe in a medical environment?
Don't hesitate to ask questions. Don't hesitate to speak up. If you go into a doctor's office or whatever, however you get there, feel free to ask, and don't hesitate to ask for assistance. There's nothing wrong with doing that. At home, there are a lot of ways that you can label your own medications and label things. Some places like Kaiser provide the Envision labeling system and so on. What the Colorado Center will teach, especially to senior blind people, is you may not use Braille very much, but you can learn to use Braille enough to create Braille labels for bottles and so on if you need to, whether it be bottles of medication, whether it be in the kitchen or whatever. The fact of the matter is there are a lot of ways to get things accomplished. Don't hesitate to ask. Reach out to other blind people. You can always reach out to me. I'm at speaker@michaelhingson.com. That's SPEAKER at MICHAELHINGSON.com. But as I said, feel free to reach out to the National Federation of the Blind, contact the Colorado Center for the Blind, and don't hesitate to inquire. Don't let yourself be trapped into this model of, oh, I'm blind, I can't do anything, because it's just not true.
Well, thank you so much for joining us today and sharing your experiences. As you said, talking to other blind people is often the most helpful things, just sharing experiences and what's worked.
Well, and people can reach out to you and to others at the podcast, and you can help be a resource to get them to the right folks. So a lot of ways to get information.
There are. And yes, we do try to help folks, whether it's a center or ACBC or some of the other local nonprofits here that work with individuals with vision loss, to help folks find resources. You can contact us at feedback@aftersight.org. So feedback@aftersight.org. With any questions or feedback that you might have, or by phone at 720-712-8856. And we can help you as well. But again, thank you, Michael, for being with us. Definitely, I would encourage folks to check out things that he is working on in his books. All of that is quite encouraging and inspirational during times sometimes that we need something that's hopeful to be able to read or listen to.
Sure. And I also will say I wrote a book for youth called Running with Roselle, and this is also available wherever books are available. And that's to teach kids more about blindness and what it's like to be blind. And it's a story of me growing up and Roselle growing up and how we met and so on. It's not so much a World Trade Center book, but it is out there too. So, but always glad to help any way I can.
Thank you all for listening. We hope all of this information, as always, has helped you to navigate your life with vision loss.